Today I'm going to walk you through traction for lumbar muscle spasm. So the goal of this treatment is going to be relax the muscle that is spasming. You can do this by intermittent, which will interrupt the pain cycle by stimulating mechanoreceptors in the joints, and this will reduce the pain and then reduce the muscle spasm. Or you can use static traction, and this will stretch the GTO, which will inhibit the muscle. This modality is appropriate because muscle spasms are one of the 5 main indications for spinal traction. Some contraindications to traction would be if motion is contraindicated, if it's an acute injury, or if the patient has uncontrolled hypertension. Some precautions would be dentures or TMJ, but since we are working in the lumbar area, these would not really be a problem. So prior to setting up the traction unit, you would want to still assess the skin and for cognition and sensation, and this just makes sure that the patient is able to tell you what they're feeling during the session and if they're actually feeling anything. Next, you want to select the parameters. So for this one, we're going to position the patient supine because that is good for paraspinal spasms. We're going to do intermittent or 1-to-1 traction. Our hold relax time is going to be 30 seconds hold and 30 seconds relax. Our force is going to be about 25 to 50% of the body weight, and the total treatment time, at least for the first session, will be 5 to 10 minutes depending on the patient's symptoms, and then you could go as high as 20 to 40 minutes 2 to 3 times a week depending on if they respond well to the treatment. For the application of the modality, you're going to set it up specific to the machine or how you would set it up to do manual traction. Some other considerations is that you just want to continually check up with the patient and make sure they're feeling good, and then after it's over you would still want to assess the skin. Besides traction, you could also use thermal ultrasound to help with muscle